think we'll get started. So firstly, welcome ladies and gentlemen. Thank you very much for your time again this week. And here we are, I think week 4 or 5 of the COVID update with Professor David Wilkinson. Just a quick reminder for those who may not have joined us previously, if you look at your Zoom screen and go down to the very bottom, you'll see a little box called Q&A down the bottom middle of your screen. If you were to click on that and type in your questions, I will be very happy to pass them on to David at the end of his presentation. So please, any questions are welcome, and we look forward to asking them, and we'll be able to move forward. So without further delay, welcome David.
Thanks very much, Paul, and good evening to everybody that's on the call. It's great to be able to do another of these updates. What I'm going to do as usual is just share with you a handful of slides that give you an update on where the epidemic is, and then pose a few questions and a few issues that I know are on many of our minds. And then, as Paul said, very happy to answer any comments or questions. We've already had a couple on the email. So on the slide at the moment is the latest data for Australia. This is a count of the number of new cases each day in Australia, and it's remarkable how rapidly this situation is changing. What you can see here is a completely textbook version of an epidemic curve, an epidemic that's grown very rapidly from the beginning of March, as we all observed, peaked in late March, and is now very, very rapidly falling. As always, the last couple of days we need to be cautious about as data comes in and gets tidied up. But it's pretty clear from this data that the number of new cases in Australia has fallen to quite remarkable levels, in the sort of order of 30 to 40 new cases each day. If I tap on the next slide, apologies that some of this is small, but I think it's useful to look at the difference by state. At the top there is New South Wales. We hold about half of all COVID cases. You remember that's due to the fact that we have the largest population. We also got the biggest international airport, and we've had the nightmare of multiple cruise ships. But nevertheless, the epidemic curve in New South Wales has taken exactly the same course. And you can see right at the end here, the last 3 days in New South Wales with very small numbers. I think it was 7 cases yesterday, announced this morning by the Premier. Now, there was a little slowdown in testing over Easter, but not much. What we're all waiting to see is what happens in the next week. And here's Victoria. Very few cases, similar to New South Wales. Queensland again has been low now for a couple of weeks. Western Australia, South Australia, ACT has no new cases, and Tasmania has an outbreak in northwestern Tasmania around the Burnie Hospital, which people will be aware of. But the picture here is now one of an epidemic that has come down to very, very low numbers consistently across the country. You've all heard of the flattening the curve, and this graph shows exactly that. So the blue line here is a 5-day moving average, which just smooths out the yellow line. The yellow line is the percentage change, the percentage growth in the number of total cases in Australia. And clearly, as you can see, it has come very, very close to zero. In other words, the number of new cases growing in Australia now is very, very low indeed. And this curve is about to become flat. So this flattening the curve, which 3 months ago nobody had ever heard of, and now everybody has heard of, has indeed happened. And just to reinforce that, as you can see in the top right here, this curve is now, for all intents and purposes, flat. I showed you a version of this last week, This is a log scale. So the difference between the lines here on the y-axis is tenfold. This is 1,000. This is 10,000. And so this is the true epidemic curve has flattened. The epidemic is under control in Australia. That is very clear. So the hot topics at the moment are face masks. So we sent out a message earlier today with some information and a couple of videos about face masks. Hopefully that's been useful to people. The bottom line here is that the prevalence, the number of cases of COVID is now so low in Australia that you have to doubt whether using face masks is really helpful. However, if you're seeing plenty of patients as a doctor or a nurse in the skin cancer clinic, and you choose to, then it would be appropriate to wear a face mask. If you're going to wear a face mask, wear it properly, use it properly. Do not allow it to give you a false sense of security. You must wash your hands, you must keep the common areas clean. And the problem with face masks is if you put one on and then you keep fiddling with it and you twist it and adjust it and move it around, that will enhance infection, not reduce infection. So if you're going to wear a face mask, use it properly. And we've sent some resources around about that. We've been asked about, well, how long will the restrictions last? What's the plan? Nobody knows. This is completely unprecedented. It is clear that the Australian government does not have a plan. That's not a criticism. I'm not being critical and silly when I say that. They're essentially telling us that themselves, that they don't have a plan. They're trying to figure out what to do. We are in a much better position than anybody imagined would ever be the case. And so the question is now, what the heck do we do next? I think what I'm hearing in offline from senior people is they're going to wait till the end of this month. If that curve continues to be dead flat with very, very low numbers, I think we can expect to see some gradual lifting and testing of restriction lifting in different parts of the country to see what happens, to see if outbreaks pop up around the place. You can imagine that's kind of going to be the scenario. They are modeling different options. Do the schools go back in term 2? Do they lift some restrictions in some areas? That's clearly going to happen. But the messaging that's coming through is this is going to go on for weeks and months in some form. And that has real implications, I think, for our skin cancer clinics and elsewhere. For me, the bottom line is very much as it's always been, which is it should be as much as we can is have business as usual. This is not something like you close down for 3 weeks and then everybody goes back to normal. We all have to appreciate that there is no going back to where our world was in January. It's not going to happen. We're going to be in a new form of normal. There's always going to be some level of social distancing now. I think there's going to be intense focus on hand hygiene, etc. That there's going to be travel restrictions for a long, long time. I wouldn't plan on any overseas holidays for quite a long time. And so I think for our skin cancer clinics, the message that we've been pushing of keep safe, keep yourselves safe, keep our patients safe, and find a rhythm of work that allows our patients to be cared for properly and safely is really, really important. We've all seen the messaging from the Prime Minister, from Minister Hunt, the Health Minister, from Brendan Murphy, the Chief Medical Officer. The thing that's really worrying at the moment is not enough patients are going to their GPs, to their skin cancer clinics, to their specialists for their routine care. And we clearly need to find a way to make that happen properly and safely. My third dot point there is You'll all have seen some very interesting stuff in the newspapers and elsewhere recently, asking the question, is it worth it? Are all these extraordinary restrictions worth it? Is the cost worth it? This question is being asked all around the world. We're all aware of President Trump wanting to reopen America at the time when, you know, literally thousands of people in New York City are dying. And they're asking these questions in the UK. I mean, they're kind of interesting questions, but we've done it. There is a clearly massive economic and social disruption, and a huge cost. But Australia is in an extraordinary position at the moment. I mean, imagine this country if we were having, you know, hundreds of deaths reported every night, like Spain and Italy and so on. We are not in that position, and it looks like we won't be. So that's something to be very, very pleased about, I think. What about a long-term view? Nobody knows, obviously. There's immense amount of work going on in creating, looking for a vaccine. There are multiple vaccine developments underway, trials underway, studies underway. I would urge caution here. I mean, this is unprecedented. If there's going to be a vaccine, then this is the effort that will produce a vaccine, right? What's going on is incredible. I would point out that we've had an HIV/AIDS pandemic for, is it 30 years now? We still have no vaccine. So it's all very well to say, let's have a vaccine. We have no vaccine for other coronaviruses. There is no SARS vaccine. There is no MERS vaccine. So, you know, let's be cautious. And while we hope for a vaccine, and we've got amazing scientists working on this all around the world, it's not a guarantee. It's really not a guarantee. We also don't really know whether immunity to COVID is real immunity and whether it holds and lasts. We just don't know yet whether you can be reinfected. So there are all sorts of queries and doubts that only research is going to show for us. I think the long-term view is very challenging. It's difficult to see how Australia will open its international borders again without mandatory quarantine, unless there's a vaccine. Maybe we end up in a little bit of a bubble with New Zealand. They're doing the same as us. They're doing it, you know, they're going harder than we are. They're at level 4. They're trying to eradicate the vaccine. I think that's where the Prime Minister's thinking is around for Australia. Maybe we end up in a bubble with New Zealand, but who knows what happens in the rest of the world. We're seeing second wave infections now, as we talked about last week, China, Singapore, elsewhere. So I think a very uncertain and quite challenging future in terms of a global position, but it's looking like a very positive and safe position for Australia. I'll stop there. Two questions have come through on the email, and then I know we've got some questions popping up here. On the email, we had a question about what do we know about the true prevalence of coronavirus in Australia. I think Francis Tan asked that question. And of course, it's the right question to ask. And the answer is we don't know, but because nobody has done the community prevalence studies to do that. However, two things. One, the federal government announced on Sunday that it is funding exactly that study to be done by the Doherty Institute. So, you know, sometime within the next whatever, that answer will come forward. The second point on that is that in Australia, we are testing huge numbers of people, and we're testing people who are more likely to be COVID positive than not, because we're testing people with symptoms, and the prevalence is less than 2%. So you would put money on the fact that the prevalence in the rest of the population is probably less than 2%, but that needs to be confirmed in studies. The other question that came through was around the BCG vaccine trials. These are really interesting trials. They're underway, I know, in South Australia and in Western Australia, and they're being run in healthcare workers to see if BCG, which is the TB vaccine, can be effective in protecting against COVID. The idea there is that BCG stimulates the immune response, and so whether using BCG will protect people from COVID. It's one of now literally hundreds of clinical trials underway, so it's really a case of we need to wait and see. If I look on the Q&A here, we have a couple of questions about hydroxychloroquine and also azithromycin. I mean, my advice there follows the advice from the Department of Health, which is these drugs should only be used in hospital in the context of a clinical trial. They've had a lot of publicity at the moment. As doctors, we all know that we should be very cautious about using medications other than under clear advice and recommendation. It's too early to do that, and we should only be considering that these drugs should only be used for patients who are hospitalized and in the context of a clinical trial. There's another question from Sarah Hewitt there about having shields installed for our reception counters. I mean, my view there is that would be overkill. You know, as I've shown you with the data, the indications are that the number of people infected with COVID is falling very, very rapidly to very, very low levels, and maybe, you know, almost zero very, very soon. And so at the moment, all of the recommendation and the advice is we don't need something like that. I think having patients, you know, one step back from the counter and the receptionist one step back from the counter is not a bad idea, so that they're not sort of close together. But I think shields would be going too far, because the duration of the interaction is so short that, again, so long as we don't have patients who are symptomatic coming into the clinics, then I think it's I think that's very safe. Paul, back to you for any further questions or comments.
Yeah, so I mean, just to Sarah's point, I mean, one thing that, you know, I've obviously seen, particularly is I'm based out of Singapore, and we're currently going through our second wave. We had 386 cases yesterday in Singapore, which is, you know, a place the same size as New South Wales. A lot of them are, you know, foreign workers in dormitories. But I think that the key thing is that if you wanted to, with the practice, it wouldn't be too difficult to get, you know, some white tape and draw a line across the front of the reception area if you wanted to have that. I mean, I think you probably would have seen anywhere in supermarkets and other places, you know, we're now putting lines on the floor to give people guidance as to what a safe distance would be. So maybe once again in your practice, if you were in a place where obviously, you know, there is one of those fears or concerns around that, that would be one way to sort of indicate to patients to, you know, stand back a little bit from the counter if that was, you know, a concern for you. And that would be an easy way to do it, and something which, you know, the patients would generally understand, I think, particularly in this current new world that we're living in. I mean, the other thing I was just going to share is just also an experience from our perspective. As you know, David works with us, we've got 9 skin cancer practices. And what was interesting, I think, you're almost going back to David's point of the curve, when obviously, you know, measures were introduced and everything. We had 591 patients cancel their appointments to come into our practices. 2 weeks ago, that was 362. And as of last week, that was 162. So that number's dropped off significantly to the point that, it's 20 or 30 a day. Now that's across 9 practices. So I think what we're seeing also is that sort of normalization of, I won't say the hysteria, but, obviously people's concerns, et cetera, and there's some sort of semblance of normal. And I think long as the media, as long as, once again, the cases do continue to fall and, the media now talks about what does, returning back to some level of normal look like, and it's more that positive news story, and we don't have a second wave as they let the brakes off. We probably should be able to return back to normal, because most of the feedback I'm getting back from general practices is we have had a drop in patient numbers. I know with pathology tests, they're down about 30% generally across the board. It is important for us to give patients comfort. There is a video which we're very happy to share with you that we got last week, which was basically editing the health minister, and then also Tony from the AMA president, once again reaffirming that to patients. So I think a lot of it is really around getting patients to understand, we are a safe place to come, and those other clinical conditions, don't ignore them, because they, basically a snowball effect of something that's going to be much larger and nastier to come. David, if you've got your Q&A panel open, there's one from Brenda Alonso that you might want to be able to answer for us as well.
Yeah, it's a great question. I mean, the issue here has been raised about whether ACE inhibitors and related medications might make COVID infection, illness worse. And the pathogenesis of this concern is that they seem to be related in terms of their receptor access on cells. I mean, the advice at the moment is certainly for patients, there's no need to stop ACE inhibitors or other drugs because of the risk of getting COVID. If patients had COVID, then I think it would be a case of managing that in partnership with a specialist. So I wouldn't be stopping treatment as a way of preventing the risk of getting COVID. And again, now, because the number of cases is so low, that we're really not we're not having to face that as a sort of significant clinical situation.
Awesome. Okay, so if anyone's got any further questions, okay, so can dogs and cats get the virus as well?
Well, they can. There are case studies exactly of that. What that really means and whether it matters is that the jury is out. But it would add an interesting angle to the whole situation if our pets were at risk as well. The end of the world as we know it.
Yeah, well, it's going to be a very interesting world we've got coming forward, and new low contact economy, which is obviously what they're now branding it, is what we'll be seeing going forward. So, look, David, I thank you very much for your time today. There's no other questions that I have here, but we'll be returning next Monday. Once again, you're more than welcome to submit your questions in advance, and I'll of course ask them today. David was referring to a video that actually we've created for our practices around, once again, who should wear masks, how should use the masks properly. Great video from the WHO. I'll organise to get that distributed to our entire HealthCert database tomorrow. Once again, and share these tools and resources that we are developing, once again, for helping our practices obviously understand and manage through this situation. But once again, very happy to share it with everybody, because I'm sure it will be of great use to you and your practices as well. But look, we're here, we're all in this together. We're here to support each other, and we will get through this. But I think, once again, I think David's point is, this has got a very long-term view at it. This is not something that's going to pass and we'll go back to normal. The new normal is going to be something very, very different for all of us. And it's not only just obviously from a medical business perspective, socially and economically, it's going to be a very different world. And I think we just need to prepare for it and just understand that social norms will change. And I think it'll be interesting. Probably the only person that's benefiting the most out of this is currently the world and the pollution side of it. I think that's obviously dropped off a cliff face. So anyway, thanks very much for your time, everybody. Thank you, David, for your time, and we'll look forward to seeing you next Monday.
Okay, thanks.